if you're seeing a GP, your appointment is 10 minutes. So you need to maximize the gain that you'll get from that 10-minute appointment. Yeah, Dr. Rumbi, I want to advocate for myself, but how? How do I do it? My name is Dr. Rumbi, and I am here to tell you all about self-advocacy, particularly in the healthcare space, particularly for women, particularly for women's health conditions. Historically, women's health conditions have not been taken seriously at all. And it comes up time and time again. And unfortunately, even now, even right now, it is still a huge ongoing issue. And women need practical tools. I mean, a lot of the time I hear from women saying, yeah, Dr. Rumbi, I want to advocate for myself, but how? How do I do it? I've been to the doctor 10 times and I still don't feel listened to. What do I need to do differently? The responsibility for making sure someone's healthcare is moved forward should not be on the person experiencing symptoms. They're carrying double the burden, if not more. However, unfortunately, that is the landscape that we find ourselves in. So until that shift happens, where as a society, we are advocating for women, advocating for the well-being of women, as clinicians like myself, I don't go to work to make things difficult for someone. I go to work wanting to help people, but clearly there is wider structural, institutional things that are going on that might take a gazillion years to fix. And how I can help women outside from the women that I see in my day-to-day clinical practice is by giving them tools to advocate for themselves. I would say the best way to split this up is to think about things to consider before your appointment, things to consider during your appointment, and things to consider after your appointment. The lighting is changing because I'm using daylight. It's the middle of the day and the sun, you know how the sun be here in the UK. It has a mind of its own. So before your appointment, I want you to think about what you want out of the appointment. We can talk all day about how hard it is to get an appointment in the UK if we're talking about GPs or accessing your primary care clinicians, because it's not just GPs that work in GP surgeries and see people. So getting that appointment can be really, really difficult. I provide bespoke self-advocacy services. And one of the first things that we come across is how can we get you that GP appointment? If your surgery has a e-consult service, or where you put your symptoms in online, put in what you're worried about online, I would say utilize that, because not only is it evidence that you've asked about this and you're seeking care for the issue that you're experiencing, it also means that someone can read it and you're not pressured on the phone. It's not like you have to call at 8 a.m. and get everything across and try and get an appointment, which could be so, so difficult. You have a little bit more time to think about what you want to put in that consultation request and really get in the impact that your symptoms are having on your quality of life, your well-being, all of that, putting it in, whereas you might really struggle to put that in to a phone call, for example. The downside with this is not every GP surgery has this option. So that would be one of the things, is getting past the hurdle of getting an appointment. And I appreciate that it is challenging. Once you've got your appointment, even before you have an appointment, I think anyone experiencing symptoms that they know they need to get looked at, keep a symptom diary. This helps to track how often you're having your symptoms, how severe they are, when they're coming. Is there a pattern? Is there a trigger? Keep a symptom diary. And it does not have to be anything complex. It can be the notes on your phone. It can be apps. I mean, there's various apps and journals that offer symptom diary facilities these days, but don't overthink it. Just keep some type of symptom diary. I would say a week is good, but the longer you have, the better you have, and the more we can identify patterns. Research. The internet can be a very dangerous place. You can search something very straightforward and end up with a way left field answer. But there are also really, really good resources out there. For example, the NHS website. The NHS website is fantastic. Interestingly, actually doesn't have all the women's health conditions. Adenomyosis only got an NHS health website page recently, I think 2024 or 2023, like not that long ago. So research your symptoms, go through reputable sources. Like I said, the NHS website. Is this a validated source of information. If it seems like it, okay, fair enough. And it can be a little bit overwhelming and a lot of jargon, but our guidelines in the UK specifically, particularly for those that work in primary care, are guided by NICE, and there's something called NICE Clinical Knowledge Summaries, NICE CKS. And it talks about various conditions. It's not for the general public, it's for clinicians. So bear it in mind as an advanced resource. I think the first step is always the NHS website. But NICE CKS talks about symptoms, what investigations we might consider for particular symptoms, our threshold for referring. Those are kind of the guidelines that we work within, particularly in primary care. So think about doing your research, noting that down, and really comparing it with what your symptom diary is showing. And if you yourself have identified patterns or think it's a particular thing or think your symptoms link with a particular thing, note that down and bear that in mind. The next step I would say before your consultation is think about what your ideas, concerns, and expectations are. What are your ideas, concerns, and expectations? Because that's what you want out of the consultation. That's what you think is going on. I would put that in my ideas. What you're worried about. What are your concerns? Are you worried that these symptoms are going to progress and become something really severe? Are you concerned that of the impact on your working life, for example, especially if you have to continually take time away from work or studying because of these symptoms? What are you concerned about? And what is your expectation? What would you like out of the consultation? Is it that you would like a referral? Is it that you would like further tests? Is it that you would like reassurance? Reassurance that what you're experiencing is normal or to be expected for a particular condition or something, right? So what are your ideas, concerns, and expectations? I would have that thought about and outlined and have an idea of this before I go into my consultation. Now, you might be thinking, why am I doing all this hard work? Like, isn't that what the doctor's for? Isn't that what the healthcare practitioner who's going to see me is for? In a standard general practice consultation, especially if you're seeing a GP, your appointment is 10 minutes. So you need to maximize the gain that you'll get from that 10-minute appointment. Part of that is doing a little bit of prior work, making sure when you're coming to the appointment, you've got everything ready and easily presented so that you can maximize what you're getting from that appointment. If the appointments were not 10 minutes long, I would say you don't need to do as much prep work. You can kind of go have a conversation and then start thinking about a symptom diary once you've seen your doctor. But because one, appointments are not that easy to get, and two, they're time limited, like I said, I really want you to get the most out of each appointment. One thing that a lot of people don't consider is bringing someone with you to the appointment if you can. And if they can't physically come with you, then can they be on the phone? Can they be on FaceTime, on WhatsApp, on a video call as well? Just to have an additional support. Because when we get into these appointments, I'm speaking from my own personal experience, even with myself being a doctor and a huge advocate, sometimes I get in there and I feel overwhelmed. The person is asking me questions and they have their things that they need to go through. And then I don't get a chance to ask what I want to ask or say what I want to say. Sometimes having someone that can advocate for you and be in your corner and who knows what your ideas, concerns, and expectations are can be so helpful because they can bring them up if you maybe forget or don't feel able to. It also means that you have someone else who's listening to what's going on, someone else who can hear what the doctor, the nurse, whomever, what they're saying to you and what their recommendations are. And then when you leave, you can be like, what was that again? What did they suggest? What did they say about this? Kind of that two is better than one. That leads us really nicely to during your consultation. I would recommend to express your ideas, concerns, and expectation early on in the consultation, because what you don't want is for the doctor to think you're worried about something else, and then they spend the whole 10 minutes consultation going through that, and then at the end you're like, actually I was really worried about XYZ. Then it's like, oh well, our time is up now. So if you can get your ideas, concerns, and expectation across early in the consultation, I would definitely recommend that. If you're feeling that you're not being listened to, then ask for clarification. Can you clarify that? Can you help me understand why we're not doing further investigations? Can you help me understand why this is normal? Just clarification. And it's in no ways in an aggressive, or it's nothing like that at all. It's just you trying to understand a little bit more about the recommendations that are being made about your health. So I think asking for clarification is really, really good. If you're finding that even with clarification, you and your clinician are not on the same page about what is going on, then this is the time where you might say, can I think on it? Is it okay if you can book me in for a follow-up appointment, and we can come back and discuss once I've had time to digest, or once I've had time to process? Or alternatively, thank your clinician for the input that they've given, especially if you've come a few times with the same concern and you've seen the same person. This might be an opportunity to say, thank you for the support that you've given me. Would you be able to refer me to one of your colleagues just for a set of fresh eyes on what's going on? As I've seen you for a couple of times and we've not got to the root of what's happening, would I be able to see one of your colleagues? Again, that's just you trying to move your care forward. They don't want you to be experiencing these symptoms, neither do you. And so most clinicians will feel fine with that. That's okay, that's fine. The downside probably is getting a follow-up appointment. The booking to be able to get an appointment might be tricky. Places that I've worked prior, as the doctor, I was not able to book in appointments. I could only ask reception if they could. And sometimes it had to go through the practice manager to approve early appointments ahead. So it depends on where you are and whether or not they can do this. If what you were seeking was a referral and the clinician is saying actually a referral is not the right thing at the moment, I would suggest to ask, at what point would a referral be appropriate? Or with what symptoms, what signs, what criteria would a referral be appropriate? And then we can think about your symptoms versus what that criteria is. Because most of the time there is good designated referral criteria on the NICE website, and sometimes in our local guidelines or to the hospitals that we refer to. So just asking for clarification on that. Another additional thing, if they feel that a referral is not appropriate, is just politely asking, would you be able to make a note of that on my record that I did ask for a referral today, and for the reasons that you gave, a referral was not appropriate. So please make a note of that. And again, that's something that's important, because when you see the next person, you can say, yes, I saw so-and-so, I've been having these symptoms for X amount of time. I saw so-and-so 6 months ago, and they said, if this is still going on in 6 months, then I can get a referral. Please refer to the documentation that they documented. It just makes it easier to communicate, because again, one of those things is we might not be seeing the same person each time. Even if you want to see the same person, that just might not be possible within the structures of our current NHS. And so good documentation. And sometimes that means saying, oh, I'm sure you're going to make a note of it, but please can you make a note that I've asked for the referral, and it's not possible to facilitate that today because of XYZ. So those are just some pointers for during the appointment. And after the appointment, if they can, some places can, some places can't, maybe send you a text message with the actions for you, because it can be quite overwhelming to then remember everything that you're supposed to do. If they're saying, okay, let's give it 3 months, and in those 3 months, try this, 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 and this, then having that maybe as a nice list for you to write down. If there's no time in the appointment for you to write it down, maybe asking them to send it to you as a text message. That can be an option. And also think about, if you can, reflect on the appointment. Were your ideas, concerns, or expectations addressed? If not, what wasn't addressed, and what would you like to address in the future? So when you're thinking about follow-up appointments, these are the things to consider. Now, you guys are probably watching this saying, I have done all of this. I've done all these steps, and yet I'm not being listened to. I'm being dismissed and not moving forward with my care. This is the case, and this is happening. And that's where we think about the next steps and kind of escalating things to move things forward. Part of that is asking for a second opinion. And part of that is maybe putting things in writing. So for example, if you feel that actually you've been experiencing these symptoms for a year and you've done your research, and according to the NHS website, if you have these, you should see your doctor, and potentially these symptoms link with this condition. And to be able to be diagnosed with this condition, you need to be referred to a specialist. Maybe writing that in an email, particularly to the practice manager, just saying, okay, these are the amount of times I've been seen. These are the symptoms I've been experiencing. This is what I've tried so far. This is what I've been advised. I think this is the next step. However, unfortunately, I've not been in agreement with the clinicians that I've seen as that being the next step. Would you be able to facilitate a second opinion? If not, would the team be able to consider a referral, for example? So that's just ways to think about taking things a step further if you feel like you've done so much already and things are still not moving forward. I hope this video is helpful. If you guys have any tips, and I know so many of you are having these experiences. Like I said earlier, so research from a women's health survey by the government showed 84% of women did not feel listened to. That's a huge chunk. So you also might have tips. Please leave your tips in the comments. Please leave any things that you found are particularly helpful or things that are not helpful in the comments as well. It'd be really, really good to know. Thank you so much. Make sure you like, comment, subscribe, and I'll see you in the next video.